Now, the two big M's up for debate in the coming weeks: Medicaid expansion and the McGirt decision. And the major stakeholders at the table, the governor, the legislature, and the Oklahoma tribes, have different views on how to proceed with each. Here's ONR's Rory Taylor.
In his address to the legislature on Monday, Governor Stitt reiterated his call to sit down with tribal leaders to resolve unanswered questions posed by the Supreme Court's McGirt decision.
The discussions have been ongoing for months, but the purpose is obviously the McGirt is a very important ruling, has a large impact on eastern Oklahoma. The McGirt decision, as you know, was limited to criminal issues only, and specifically the Major Crimes Act.
Governor Stitt certainly wants to negotiate criminal and civil jurisdictional issues. And I know that the Cherokee Nation and the Choctaw Nation in particular are interested in having Congress pass some legislation that would enable them to negotiate criminal jurisdiction with the state.
The McGirt decision addresses criminal issues, but the governor believes the implications of the ruling could extend far beyond that.
Hundreds of criminal cases are being dismissed. This ruling also raises many other unanswered questions. Do tribal members living in eastern Oklahoma pay income tax and sales tax?
Some have suggested that McGirt could be expanded into civil areas, taxation, regulation, zoning. So really all of those discussions are going to be had. Obviously the criminal issues, which were the focus of McGirt, are going to be the principal areas of discussion, but really everything's on the table.
And those discussions will be heavily influenced by a separate gaming-related Oklahoma Supreme Court decision, Treat versus Stitt, which limited the governor's ability to negotiate compacts with tribes.
Not just gaming compacts, which that case dealt with, but also any compacts. And it says that they have to be statutorily granted from the legislature for the governor to have them approved. Governor can negotiate, but he still has to have them approved by the Joint Committee on Tribal-State Relations.
That ruling will affect annual compact negotiations, like those for state and tribal hunting and fishing licenses, requiring legislative approval after the state and tribes negotiate.
Together, we must create the certainty, fairness, and the unity we've enjoyed since 1907.
House Democrats criticized the governor's language regarding those negotiations.
I found it very telling that the only time we actually heard the word sovereign was in reference to the state of Oklahoma, not in terms of our sovereign tribal nations.
The legislature must also address funding for Medicaid expansion and the governor's decision to move forward with a plan to partially privatize the program. 4 health insurance companies have signed contracts worth $2.2 billion with the state to provide managed care. That plan has been met with heavy skepticism.
I found this process, especially the RFP, to be very opaque. The most opaque, transparent government I've ever seen. And yet, the executive branch and you, Mr. Secretary, would love for us to get on board with that when we have had absolutely no input in it.
Supporters of the program, called Sooner Select, argue that it will protect the state from financial risk.
40 states have found managed care is the best way forward. Texas, Kansas, Iowa, Tennessee, Florida, even California and Illinois. It's not a red state thing or a blue state thing. It's the smart thing to do.
Opponents of the program say that it's similar to one that failed previously, and that it could reduce rather than expand access to care for low-income Oklahomans. In a statement on January 21st, State Senator George Burns of Pollard said, "My district is on the border between Oklahoma and Texas, so I have constituents with experience working with managed care in Texas, and none of the people I've spoken to who've had to deal with managed care systems believe it's good for the patients or the healthcare system. Based on my conversations, they aren't sure who it's good for other than out-of-state insurance companies and their stockholders." Rory Taylor, The Oklahoma News Report.